This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy!
Welcome everyone to Ask the Expert series brought to you by Clinical Compound Pharmacy. My name is Lauren Aller. I'm Vice President of Operations here at Clinical Compound Pharmacy. And today I have with me our pharmacist in charge, Krista Ohlers.
Hello.
And we are going to be interviewing our expert, Jenni Berman, PAC from Berman Health and Wellness. She's going to be talking about fitness, nutrition, health, and how it plays a role in optimizing hormones. Jenni, would you like to take a few minutes just to introduce yourself and tell us about what you do here in Naples?
Thank you. Yes, Berman Health and Wellness is a functional medicine practice in Naples, Florida, where we help individuals to reach their goal weight and optimize their gut health without needless medications and achieving the highest quality of life possible. So basically what that means is we're helping individuals day in and day out, figuring out the problem, not just treating symptoms, treating problems, not symptoms, to their overall health, whether that is optimizing their weight, helping with their autoimmune disease, helping with hormone imbalances like we've worked with clinical compounding for, and just really improving their quality of life through sleep, energy, and overall health.
It's awesome. We need a lot more practitioners like you in this day and age. So very cool to hear about what you do here. If patients needed to reach you, you're located here in Naples. You have, at the end of the interview, we will make sure we have all of Jenni's contact information, her website, office, phone. So if anyone's interested in reaching out to her, we will provide all that. We're going to get into our first question. And this is the first one we have for you, Jenni. Can you explain the importance diet plays in hormone balancing? For example, those people starting at zero, maybe you can touch on this after you go through. You have people that are all at all different levels, just even from the beginning, simple changes they can make to support their hormones and general health. So basically the importance of diet, like where is that at? Because you have people that just don't even understand that there's a connection there.
Absolutely. And I am so grateful that we're starting there, since the majority of what we do is nutrition-based medicine. So really looking at an individual from the inside out, looking at their gut health, looking at their meal plan, meaning the foods they're intaking on a daily basis, everything from carbohydrates, proteins, fats, to food sensitivities, gluten, dairy, eggs, and really figuring out how each of these things is playing into the individual themselves. So we work with clients each and every day that have complaints of hormonal imbalances, meaning poor sleep, menopausal weight gain, mood swings, low energy, low muscle mass, and they just aren't sure where to start or where to go, other than they know their hormones are imbalanced. So what can they do? And sure, as we go through life, our hormones change, whether it's through a trauma or just a simple aging. Our hormones change, and the levels of estrogen, progesterone, testosterone are all important, and optimizing those levels are important. But what a lot of people don't understand is that your food is playing a primary role into that hormonal change that's happening throughout your lifestyle. So yes, as we age, things change, but our food and the diet plan that we're following is impacting that age-related change that we're having. So it doesn't have to be that way necessarily. So not only the types of foods, meaning the carbohydrates, the proteins, the fats, but also the inflammatory foods, the gluten items, the dairy items. So for some individual, things like almond or egg can be inflammatory, play a role. Our hydration, our vitamin levels are all impacting how our hormones are able to stay balanced throughout our life. I want to touch a little bit more on the carbohydrates and sugar, as that's one of the biggest things that we see in our practice as far as impacting our hormones.
Right. I think, unfortunately, just the way our food industry and how everything is very heavily processed, a lot of carbohydrates are just in easy accessible food. So people tend to reach for them. It's a lot of heavy and fast food and quick foods food that people are consuming at high levels all the time.
It definitely is. And honestly, individuals don't even know that they're consuming as many carbohydrates as they do. They don't realize that fruit is a carbohydrate, or corn and peas are carbohydrates, or things like the chickpea pasta or the lentil pasta. It shows that it's a protein pasta, but it's still a carbohydrate-based pasta. Same thing with lentil beans or black beans or pinto beans. These are all still carbohydrates. Most individuals think of carbs and sugar as the rice, the potatoes, the bread, the sweets, the pastries, which is all simple carbs, definitely. But those other items that we talked about are just as important when it comes to how many carbohydrates they're intaking. A lot of our clients don't realize, again, how many carbs they're getting in. But as you mentioned, carbohydrates are just more available to us. It's an easy go-to thing. It's, a lot easier to grab the cheese and crackers than it is to make yourself a protein-based meal, although there are some easy options for protein-based meals too. But these carbohydrates and sugars are directly contributing to the changes in our progesterone, estrogen, and testosterone levels on a daily basis. And that's why I wanted to really go in and talking about those. The reason being is they impact our cortisol level. So whenever we have more carbohydrates and sugar in our diet or in a meal, the cortisol level, which is a stress hormone, increases, which in turn affects the release and balance of the progesterone and estrogen within our body.
That's interesting. I don't think a lot of people, like I said, when we initially started, understand how food plays into your hormones. They're just like, oh, I'm getting older. My hormones are weird. And then you take a look at the diet, and what are they having for breakfast? Toast. What are they having for lunch? A sandwich. What are they having for dinner? Pasta. And it's just, would you say when you do have a patient come in, is that one of the first things you do? You sit down with them and say, let's take a look at the diet. What are you eating during the day? How can we go from here? Like I said, if you have someone that comes in and does have a diet similar to that, what is a simple change that you make right off the bat for them, even before you go to testing or take more of a deep dive?
Most definitely. And that's a great question. And yes, to answer your first question, is looking at the meal plan is 100% something we do in the initial consultation with our clients, because it plays such a big role into a majority of the symptoms patients are feeling. And I'll talk more about this, I'm sure, at a later point in this podcast, but one of the biggest impacts is how much protein a patient can get in their diet. So that's really, really important. But if I were to give one simple change, it's not an easy change because it takes work and dedication and preparation, but it is simple in the fact that it's minimal work with a very big outcome, would be to avoid the simple carbohydrates like the ones we've already discussed at dinner time. So focus your dinner time on your proteins and your vegetables, really avoiding the simple carbohydrates anytime after 2:00 in the afternoon. And that's going to be the first simple change to adjusting how the body is craving carbohydrates or looking for carbs. It's going to affect our sleep cycle, our cortisol hormone, which is then going to transition into these other hormonal changes.
I love that. I think with anything, you're going to have people at different levels, obviously, where they're at in their lifestyle. And one hesitation people might have, a lot of people want to have the quick fix. And, it seems scary that they would have to change their diet. But just knowing that they could start kind of gradually, like you said, like, let's just take a look at dinner. Let's start there. That would be something that I think is a great approach to getting your patient on board it, like having them, let's start this process and we can go from there. You're not going to do anything overnight. It's not going to be drastic, but we have to start somewhere and, putting in new behaviors. So that's really cool to know that when you're going to accept people from different, wherever they're at health-wise, that, there's just small changes that can add up to the big change. So that's really cool.
Exactly it. One step at a time. You're not going to go from eating one meal a day to 5 meals a day. You're not going to go from eating, a higher carbohydrate meal plan to no carbs at all. And really you shouldn't, because it's, you're going to have other side effects to that. So that's exactly it. One simple change each week, which is part of the reason why we see our clients every week, is to be able to have the ability to make those simple changes.
I love that. I think you do need a lot of, especially when you're starting something new, you need a lot of hand holding. And that's really nice that you guys, that, your practice offers is that type of support, especially when anything to come with hormones as well, too, which ties me into our next question. We're going to take a little bit more of a deeper dive into the hormone aspect. I know you were mentioning, progesterone, estrogen, testosterone, and, depending where people's knowledge level is at, you have people that are like, what are you even talking about? To other people that are like, oh, yes, they're very well versed in hormones. Crystal, hopefully, you could chime in as well. Crystal is very well versed with our hormones. So hopefully you guys will get a pretty good back and forth here. But this kind of goes into the compounding, aspect of it. Do you prefer your patients receive synthetic hormones, for example, the commercial product Berman, or prefer patients receive their hormones compounded from a natural source? That's what we do here at Clinical Compound. When would you suggest a patient supplement hormone replacement? So it's kind of a multiple part question. I guess we can start at synthetic versus compounded, advantages, disadvantages there, and what you tend to use in your practice.
Absolutely. And that's a great question. So, I'll kind of relate it to food because we are, primarily a nutrition-based practice. Is whole foods will always be better than processed food. So natural hormones are always going to be, I shouldn't say always, 99% of the time are going to be better than the synthetic form of hormones for most individuals. Now, of course, that has to go on an individual basis, and certainly one will work for someone that doesn't work for the other. But for those who don't understand the difference, bioidentical compounded hormones are typically plant-based and naturally made hormones that can match the chemical makeup of the human body, whereas synthetic hormones, even synthetic thyroid medicine, are chemically altered and do not match the human genome or the human hormone makeup. So if I had the option of choosing a compounded hormone replacement versus synthetic, absolutely going for the compounded hormone would be a better option to allow us to, one, be plant-based and more natural, so it's cleaner, but also being able to provide something externally to the human body that is more natural or in line with what the body used to naturally make if you're not making hormones anymore. And Crystal, since you're the hormone expert, you might be able to comment a little bit on that as far as how I explain the difference between the two.
Oh, yeah, you did a great job. That is definitely how I would describe the difference between the synthetic and the natural hormones. Another really good benefit, I think, in the compounded options is things like progesterone capsules, where people have commercially available options, but they are oil-filled caps with peanut oil. And a lot of people have allergies and they don't even know that when they go to pick up their progesterone, and they could have a serious anaphylactic situation. To me, it's just, if you can get a compound, if it's financially feasible, it is a good option. But like you said, it's a spectrum. Everybody, it's not for everyone, but if you can, I think it's a better way. And we don't use lactose as a filler, but some people do. If you're lactose intolerant, you can take out that filler. Or, we don't use dyes in our capsules, like things like that. You can really make it as clean as possible to get your medication.
Absolutely. And, to piggyback on that, I think the other very positive thing to compounded medication and hormone replacement is we can make the adjustments. We can modify and adjust for what a patient needs specifically, as opposed to a one size fits all. Here's 200 milligrams of progesterone. That's what you have to take because that's what's available at the pharmacy. So if, for instance, I'm going to go on thyroid medicine again, but if we're doing a compounded thyroid medicine and we need more of the T3 than the T4, we can make that adjustment, as opposed to synthetic hormone, you can't. Same thing's going to go for bioidentical hormones as far as estrogen, progesterone, testosterone, things like that.
Yeah. And even going back to the thyroid, we are able to also, NP thyroid, Armour thyroid, those are natural porcine thyroids. But again, they come in specific strengths. So if somebody needs 75 milligrams of porcine thyroid, we're able to accommodate that. So that's also nice that, being able to really tailor it to a person's needs is nice.
For sure. Absolutely.
The later part of that question was, when you have a patient, when would you go and suggest that they were going to supplement hormones? Like, are we testing? How do you kind of come to that decision with your patient when they would need a hormone support?
That's a great question. And 100% we are a data-based clinic, right? So we want to see for each individual, what does the lab work show? What does the blood show that the individual is deficient in? And can we make any natural changes to the individual? Now, natural changes take time. So there are times where the client is like, my sleep is absolutely horrible. My energy is absolutely in the hole. My mood swings are awful. I'm about to get a divorce because I can't control my mood swings. So in that case, we certainly would want to add something on board through the compounded hormones, while we're also making the lifestyle adjustments that we can to optimize the ability to absorb these hormones and to actually have the true effect of what the hormone can do with our cortisol control and our blood sugar control. So monitoring blood work is, in my opinion, very, very important to know, are we at the right dosage of the medication? Do we need to work with the compounding pharmacy to make any adjustments to the compounded medication while we're also making these lifestyle changes? And that, goes into testosterone levels. Like, yes, testosterone is important for a female, but we really don't need very high levels of testosterone, whereas men need a higher level of testosterone and lower estrogen and progesterone. So it's finding that right balance for the right individual based on how sedentary, meaning not moving they are, versus their exercise level being a little bit higher, what their meal plan looks like, and their ultimate goals are.
I love that. It's really cool that you have many tools in your toolbox as a practitioner to be able to offer your patient a full spectrum, because, even if, like you said, they do really get those diet and lifestyle changes on board and they're, successful at them, the body could still be, depleted in a hormone or multiple hormones that you can use through a compounding to help, that person reach their optimal health, which is really cool that you have, different things that you can use outside of what you do in your office as well too.
Right. 100%. And we have a pharmacy like you to utilize.
It's music to my ears to hear that you're doing levels, because I've lived in states where that's not always the case. When I was taught about dosing hormones and everything like that, it's always, you have to make sure to get the patient's cortisol under control first. And the fact that you're able to do that with nutrition is so nice. And I love that you guys are really monitoring all of that to make sure that your patients are getting just what they need without too much.
Right. And that's huge. Cortisol is something I check in 99.9% of the patients we see in our practice. I check cortisol, and it's amazing how many people actually have a high cortisol level and have never even heard of cortisol before. They don't even know what it is. And I'm like, this is impacting majority of your symptoms here.
Right. It is. It's incredible to know. I mean, that's what I said, like even initially in the beginning, you have people starting at 101. I mean, this is even a lot of things that we could be talking about here would be very foreign to them. And I mean, that's what's great about both of our industries. I feel like when you kind of take a little bit of step out of the box, you're able to really get creative and help people in ways that maybe traditional care can't give, which is cool. I mean, that's very much compounding. That's very much functional medicine, which is a different approach. And I mean, you see it through your patients. We see it through our patients. Crystal is working with them every day. I mean, life-changing experiences when you're able to really take control of your health and implement things in that are going to, optimize you. So that's really cool. Okay, our third question, if we can kind of segue into this, we talked about diet, we talked about hormones, but there's also that exercise component, that fitness component, which is really important, as far as balancing hormones. So what we wanted to say is, what are the benefits of exercise and hormone health? And then, do certain hormones help your overall performance? Like, for example, obviously we would know right off the bat, maybe men and testosterone, but also for both men and women. So let's just talk about fitness. I know that's a very big part of your practice. I follow you guys on social media. You put a lot of good content out with workouts, and Jenni's husband is a doctor of physical therapy. So they have a really great setup there, and they offer a lot of, support in the fitness as well.
Absolutely. And fitness is different for everybody. What does that mean for one individual versus the next? But in general, the fitness, the exercise, the movement is just important for our body, not only for weight control. People think, oh, I have to go to the gym and work out so I can maintain my weight or lose weight. But even more important than that, the mind, the muscles, the stress response, the hormone control are the top 4 reasons to being able to exercise or needing to exercise. We need to be in a caloric deficit to lose weight, meaning we have to burn more calories than we intake to lose weight. Although we also need the exercise component to stabilize our hormones to be able to lose fat and gain muscle mass. And if our hormones are not optimized, it doesn't matter how big of a caloric deficit we're in, we're not going to be able to burn fat and gain muscle. And that's something we see in our clients every day is they're like, I'm not eating, but 800 calories a day and I'm not losing weight, or I'm exercising 2 hours a day and I'm not losing weight, or my sleep is still horrible, my energy is still horrible doing those things. But how are you fueling your body? If our cortisol levels aren't controlled, as we've talked about multiple times, if our hormones aren't balanced, then we're not going to see the effects of the diet or the exercise itself. Exercise releases endorphins, which are the happy hormones, and it controls their cortisol levels. It helps with producing melatonin, which in turn is going to help with controlling that cortisol that we've already talked about. Testosterone levels are important in both men and women. Estrogen and progesterone levels are important in both men and women, and those definitely are impacted by our muscle mass and our exercise component.
Very cool.
To kind of summarize your question, then we can go into the next one is, exercise is different for everybody, but it's certainly going to play into our body's ability to make and sustain our hormone levels.
And is that something that when a patient initially is going to start with you, I mean, like I said, I'm trying to use everyone's at a different level. You're going to have someone that, like you said, they're at the gym 2 hours a day and they are hitting a wall. They're still struggling. And then you have someone who maybe they never exercised in their life. So you're going to work with all different people at all different levels. Initially, when you are working with your clients, your patients, how often are you suggesting that they exercise? Is it daily movement? Do you want more structured exercises? I mean, I know you're starting with people all across the board, but what are you, in your expertise, like what would you think is the most people are going to get the most benefit out of health-wise?
I say if you can move your body for 30 minutes, 5 days a week, that is a goal. Now, if you're not starting there, my goal for you is move your body for 10 minutes a day, 3 days a week. Next, instead of going to 20 minutes of movement, move your body 10 minutes 2 times a day. So you're getting out first thing in the morning and doing a 10-minute walk, meaning you're walking away from your house for 5 minutes, you're walking back to your house for the next 5 minutes. Do that again after lunch or do it again after dinner. And it doesn't have to be that you're spending 60 minutes in the gym, especially when you don't have the time for that or the mental capacity for that or the endurance for it. So if you can get your body moving for 10 minutes at a time, 2 times a day, 3 times a day, for 3 days a week, 5 days a week, that is a starting point, and that is enough. That is going to be enough to get your body moving in the right direction and stimulating those endorphins, the happy hormones, to help with balancing the other female and male hormone levels.
Wow. It's really neat to see that there's a lot you can do, just little things to really optimize your hormones. And then obviously, like we said, if you need the help, you can come to a compounding pharmacy and Crystal can make you up a compound and, you can take it to a balanced level. But just off the bat, I think it would be really good for people to understand that these small changes, like you said earlier, taking carbs out at dinner time or, trying to make a walk after dinner or do one in the morning, that's not too much to ask of someone starting out on zero. These are very simple changes. I think it's good for patients to understand that it's not going to be, catastrophic and the whole life's going to be turned around. They can really move to better health by doing things that are simple, working with a provider like Jenni, who really understands, all of these things and why it's so important to make these changes to, to get better health. So we're kind of closing out to the end. Crystal, Jenni, is there anything that you'd like to leave our audience with that you think is very important as far as just, or you want to reiterate something that we talked about, just to get across to kind of close out our interview for today?
I think you said it at the end there, is it's simple changes. We already talked about it's not easy, but there's simple changes that can make a huge impact on your life. And the fact that it has to be a lifestyle adjustment. It has to be something that you can start and make maintainable adjustments to reach the goals that you're trying to reach, whether it is through dietary changes, exercise changes, hormonal changes. I'll say one thing is we mentioned in the beginning that our practice treats problems and not symptoms. And a lot of times the symptoms that individuals are feeling of hormonal change, so the fatigue, the sleep issues, the mood swings, the abdominal fat or the low muscle mass, these are symptoms of something else going on within the body and the metabolic system. And so, yes, we have to look at the hormones and get these balanced, but we also need to be looking what's causing the hormone imbalance. Is it actually a cortisol issue? Is it a blood sugar issue with insulin resistance or prediabetes, a vitamin deficiency? Because as we said, optimizing these internal issues, metabolic issues, is the most important factor for the hormones to be able to reach their optimization and to actually see the true benefit from it. So seeing a functional medicine practice, and it doesn't have to be functional medicine, but a lot of times you don't get all the answers you want in Western medicine. And I'm allowed to say that because I'm a PA who went to school for Western medicine. But, just seeing someone that actually is going to look a little bit deeper into the body and helping you make these simple lifestyle adjustments.
I love that. Crystal, do you want to touch on anything on the compounding end, on hormones, or?
I think I've kind of covered what I needed to, but I did want to just further endorse functional medicine because I just think it's really important. I think a lot of people are kind of heading towards that way and seeing how important functional medicine is. And I just think that's really great.
Jenni, we loved having you. You are just such a wealth of knowledge. I think you offer something really special to Naples and beyond. I'm sure that you work with people from, all over because we have obviously a lot of seasonal people here, but you have a really, really fantastic mindset on this. We're very grateful to be able to work with you and service your patients. And it's just a really cool kind of little partnership that we've made. And, we just wish you can continued success. Thank you so much for taking your time with us today. Like I said, I will include all of Jenni's contact information. You can reach out to her in her practice. Hope to speak with you again. I know we definitely will, because we definitely have more to talk about but within a certain time. So awesome. Thank you so much.
Thank you so much for having me. It was wonderful, and definitely we'll be back. And, to kind of say the same about you guys, we're really grateful to have such a great compounding pharmacy to work with and to answer all my questions when figuring out the exact dosage isn't my forte, but Crystal is always there to help.
She's on it.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.